If you're a dental hygiene student who needs help in oral pathology, this video is for you. Today we're going to be talking about the difference between enamel hypoplasia versus amelogenesis imperfecta. So enamel hypoplasia is something that is acquired. Amelogenesis imperfecta is inherited. So enamel hypoplasia is something that happens during tooth development, either in utero or after you're born. So your primary teeth or permanent teeth are still forming, not inherited. Something is disrupting the enamel matrix. Now, if you remember oral biology, where we talked about amelogenin and how it's a protein that helps make the enamel matrix. Anyway, so examples of the types of causes. High fever, like chickenpox, measles, scarlet fever, vitamin deficiencies, trauma, fluoride excess, which is also known as fluorosis, and an infection of a primary tooth, Turner's tooth, where a single tooth is infected. Side note on fluoride, when fluoride is used 4 times in the amount that it's needed, molting or brown staining is what occurs. And a fun little fact, fluorosis enamel is a little bit more resistant to decay. Not completely, but just a little bit. So hypocalcification looks like a little white chalky areas. This is still in the hypoplasia family because the enamel didn't mature properly. And we have these things called Hutchings or mulberry molars. This is from congenital syphilis, not genetic, but a developmental disruption. So a hypoplasia, meaning undergrowth. Now amelogenesis imperfecta, inherited, remember? This is passed down through genetics. So this affects all the teeth, or almost all the teeth in both dentitions. And there's 4 types. Type 1 is hypoplastic. The enamel matrix didn't form correctly. It's thin and pitted, and the enamel's really rough. And it looks like that. Type 2, hypocalcified. Matrix is formed, but not mineralized, so it's soft. This looks similar to fluorosis, but the cause is genetic. It's called a kallikrein gene. It's not fluoride. Type 3 is hypomaturation. Enamel is formed, but not matured. Classic snow cap appearance. This is mostly on the incisal thirds or occlusal thirds, or occlusal cusps. This is due to an X-linked gene. Lastly, type 4, hypoplastic/hypomaturation. This is a combo of poorly and thin matured enamel. It often looks kind of yellowish brown and radiographically can resemble tarodontism. Quick little bonus for dentogenesis imperfecta. This is when dentin is affected. It's often associated with osteogenesis imperfecta. That's type 1. Type 2, hereditary, but not linked to bone issues. Teeth will look opalescent or brown/translucent. There's also type 3, but that only is seen in a small population in a Maryland town. So we don't talk about that. And then a reminder, Turner's tooth, localized enamel hypoplasia on 1 permanent tooth caused by an infection or trauma from a primary tooth. All right, well, I hope that helped. Have fun studying, and I'll see you later. Bye.